I'm Dr Bartholomew. I'm a consultant anaesthetist.
It's very nice to meet you.
You too. I understand you've got some questions for me about anaesthesia.
Yes, I do. So my first question is, what is anaesthesia and what is actually going into me?
So anaesthesia is a state of controlled unconsciousness which is closely monitored by the anaesthetist. And the medications that will be actually going into your bloodstream include the anaesthetic drugs, some strong painkillers, possibly some anti-sickness medication, and sometimes a muscle relaxant. You may also be breathing some anaesthetic gases throughout the duration of the anaesthetic.
And will it be bad for me? Are there any after effects?
Well, given that you need to have an operation done under a general anaesthetic, it won't be bad for you as such. However, there can be quite a lot of side effects which different people experience in different ways. It's very common to wake up feeling very, very tired, perhaps have a sore throat, a headache, feel slightly queasy, and occasionally you might have some pain in the area where the surgery has been performed. However, some of these things can be treated.
And roughly how long will I be under?
So let's say your operation takes about half an hour, then you can expect to be asleep for the best part of an hour, and that allows for a little bit of setting up time at the beginning and then some awakening time for you at the end. If your operation took a lot longer than that, then you would take longer to wake up afterwards.
And when I'm under the anaesthetic, will my brain still be working? And is there a chance that I could still wake up in the surgery?
So your brain will be ticking along at a very minimal rate, so you won't be able to hear, see or feel or remember anything. However, some people do have what we call recall at the beginning of the anaesthetic, and as they're waking up at the end, they can hear people talking to them. The chances of waking up during the anaesthetic are very low indeed, so about the order of 1 in 60,000. And this could be associated with some feelings of distress or painful sensation, but that is extremely rare indeed.
And what is the chance of something going really wrong and me not waking up at all?
I'm glad you've asked that question. I think a lot of people would like to, but don't have the courage to ask it. I'm really glad to say that the chances of that happening are very, very rare indeed, and modern anaesthesia is extremely safe. For a fit, healthy young person, the chances of not waking up after the anaesthetic are of the order of 1 in a million. And a lot of the studies that have been done and the figures quoted have actually been on older adults who are, elderly and less fit and well, and so their statistics aren't as good as that.
And can someone from my family be there on the day?
Oh, of course. So your mum, dad, a carer, a relative, anyone who's an adult can accompany you, and they can come into the anaesthetic room with you if you want. However, if you prefer that they don't come in at that point, then that's absolutely fine too.
So if I have any more questions, is there somewhere I can find the information?
Yes, absolutely. So the Royal College of Anaesthetists website and the Association of Paediatric Anaesthetists website, both of those have specific patient information and specific information for young people. You'll also have an opportunity to ask more questions if you come along for a pre-assessment. You may be asked to do that, and of course on the day of the procedure.
Great, thank you so much.
You're very welcome.